In today's Ask Me Anything with Dr. Chuck. Dr. Chuck, we want to know what causes a cavity?
That is a fantastic question. It wasn't only until about a year and a half ago I started asking all my patients that same question. I should have been asking this question my entire career, but I didn't, because the answer I normally get is, what causes cavity? Oh, it's sugar. It's not brushing your teeth. It's genetics. It's these different things. Those are what we like to believe, but that's not true. In order to have a fire, we'll start with a fire first. In order to have a fire, we need three things. You need the fuel, you need oxygen, and you need the ignition source. If you take away any one of those three, you cannot have a fire. Cavities and gum disease are the same thing. It takes three things. Number one, it takes a tooth. Number two, it takes food. And number three, it takes bacteria. If you remove the tooth, there's no more cavity or gum disease, but there's no more tooth either, and that's not nice. If you eliminate the food, there's no more cavity or gum disease, but we die. We need food to live on. If you eliminate the bacteria, there's no more cavity or gum disease. Well, why is that? When you and I eat food, we have byproducts. We poop and we pee. Well, when bacteria eats food, it also has byproducts. So one of those is lactic acid. When bacteria sticks to the teeth, we give it a name. You remember that name? That name is plaque. So we got the plaque up against the tooth, eating foods that we have, and you're right, some foods are worse than others. Sugars, carbohydrates, those are worse. So you've got the bacteria against the tooth, eating the foods, dumping acid on the tooth, or if it gets down under the gums, it sets up an immune response down there, which is gum disease. But if you got the bacteria demineralizing the tooth, that's what causes the cavities. So if we get the bacteria off of the teeth, there's no more cavities or gum disease, but we have a challenge there. The bacteria is the same color as your teeth. How do you know you got it off? A lot of you are aware of, some of you, when elementary school, use something called disclosing tablets. Those little tiny pills that you chew up to stain the bacteria. Well, you can buy them. Amazon has them. You can buy them. Drugstores may have them. But clean your teeth as thoroughly as you can, or in your mind, you've done a great job. Then chew up one of these little things, get your tongue to move it all the way around, rinse your mouth out with some water, and go look in the bathroom mirror. Put your cheek back, get a flashlight. Wherever you have stain on your teeth, where you still have bacteria, you still have the plaque. Now go back and clean the stain off. That's when you begin to learn what it really takes to thoroughly clean your teeth. It's not easy. You can't do it in 30 seconds, which is what the average person spends cleaning their teeth. But if you'll spend that time, one time a day, 8 to 10 minutes, you'll remove the bacteria that causes the acid that causes the cavities and the gum disease. So what causes cavities and gum disease? It's the lactic acid from the bacteria on the teeth that you haven't removed, where you haven't removed the bacteria. So it's not just the sugars. If you have no bacteria on your mouth, but a mouthful of sugar, you're not going to get cavities. Now, it's not healthy for you. It's not good for you, but you're not going to get cavities from it. It takes the bacteria. So let's get rid of the bacteria and let's have a healthy mouth.